Facebook, YouTube, our live streaming, and thank you again for all our tech support people. We really appreciate it. We continue today the Koinonia process to learn about the needs, trends, gaps, and challenges of our community as we discern how to be shepherds of service powered by Christ's love. Reminder to our Zoomers, if you have any questions or comments, Randy Brantley is monitoring Zoom. Please put your questions and comments in the chat room. I'm going to stray from our collect today because I want to read some of the lyrics from one of the hymns this morning, the Servant Song. Let me get that up. Brother or sister, let me be your servant. Let me be as Christ to you. Pray that I might have the grace to let you be my servant too. We are pilgrims on a journey. We are brothers on the road. We are here to help each other walk the mile and bear the load. I will hold the Christ light for you in the nighttime of your fear. I will hold my hand out to you, speak the peace you long to hear. Our speaker today is Dr. Andrew Nance. He's a family medicine doctor working with Atrium Health at Cabarrus Family Medicine in Kannapolis. In addition to seeing clinic and hospitalized patients in Cabarrus County since 2016, he has become the physician leader of all community health matters. Dr. Nance works closely with the Cabarrus Health Alliance to address unmet health needs of patients in Cabarrus County. When he's not working, he's spending time with his wife, Reagan, who's here today. Where are you, Reagan? Welcome. And their two cats, Onnit and Birdie. Today, he will be speaking to us about the social determinants of health, the connection between social needs and physical well-being. Please join me in welcoming Dr. Andrew Nance.
Much for that introduction. Mic check. We okay on sound? Awesome. Thumbs up is a good thing. Thank you so much, Karen. Much appreciated. And I'm really grateful for this opportunity to spend some time with you. I think we've got set aside about 25 minutes or so, and then some time afterwards for some questions. And I may be asking kindly to, advance the slide. If you could go ahead and advance it one time, that'd be great. And so a special thank you to Dr. Robinson and Karen. Thank you so much for this opportunity, and thank you for the congregation here for allowing me to spend some time with you. So actually, if you could take it one slide back, that'd be great. I appreciate that. Thank you so much. So I've always been impressed with All Saints. So since I've been in the community about 5 years, I've come to learn how much All Saints has done for the community. Salvation Army, working with Cooperative Christian Ministry, the Community Free Clinic right across the street. So I learned very quickly that All Saints is a power and a wonderful organization for the community. So thank you for all that you do and for the opportunity to be here to advocate for the needs of our patients and their families. I actually have collaborated with All Saints before, about 2 years ago, right before COVID hit. We had patients from the Community Free Clinic come over here. You guys were gracious enough to open your doors so that they could spend time working with health educators from Cabarrus Health Alliance to learn about reading nutrition labels, to learn about creating exercise goals. And they would spend time right behind you with the table and working through a textbook together. And we also used that time in your kitchen to start preparing some healthy foods for those that were participating. And it was a really fun experience. And I remember a few things vividly. I remember that a lot of the free clinic patients didn't know much about cooking healthy. And I can say that's probably common for a lot of people out there, no matter if they have insurance or if they do have insurance. What I also learned is that a lot of the conversations that were had in the kitchen were really deep, that having kind of a thing to do together, such as healthy cooking, was a way to break the ice and to have some conversations that hit at a deeper level. And I remember it was such a wonderful time where there were both sides contributing to the conversation. So I remember some of your congregation members were here and they were talking about their experiences. And then I also remember patients from the community-free clinic talking about their experiences. And it allowed for a lot of awareness about, wow, I didn't realize that was happening at the county level, or I didn't realize it was so hard to get your Medicaid application in, or I didn't realize it was so challenging to submit your food stamp application, a whole variety of things. And I would say that if you were to ask me, well, what are some of the needs that are still around for our community, I would say it's same needs that were 2 years ago, specifically about how to cook healthy and how to eat healthy. And what I hope today to talk about is the power of healthy eating and how that could be a wonderful opportunity to contribute to the community at large. So please feel free to go to the next slide. Thank you. So from that time together, with patients in the community-free clinic and congregation members from All Saints, I realized that that was a perfect example of healthy eating. And then I also realized that it was also another example of social connections and healthy relationships. And those are two needs that patients tell me time and time again of what they're seeking. And this is just 2 of the 6 pillars, as we call them, within lifestyle medicine. And lifestyle medicine is a national and international movement about how can we prioritize lifestyle changes for people so they can be the healthiest versions of themselves. And you'll see there are a few others. One, so at the very top, about increasing physical activity. On the blue is about developing strategies to manage stress. Forming and maintaining relationships. And then at the bottom, you can see in the purple is about ways to improve your sleep. And then cessation of tobacco, which also includes other risky substances. And then back around to healthy eating. So for me, as a family medicine doctor, this is the framework that I try to practice medicine, about prioritizing these changes in addition to medications when needed. And so I would encourage you to think about, as you go on to consider ways to contribute and collaborate with the community, is there something within this lifestyle medicine framework that would really resonate? And again, I would advocate for giving some serious thought to healthy eating. And by healthy eating, I'm talking about how can we help people eat more whole foods, things that come from the ground, a tree, plants. And so we've found that this has been quite powerful. So if you could skip to the next slide, please. And if we could just help people eliminate poor diet, sedentary behavior, and smoking, we could reduce and prevent 80% of heart disease and stroke, 80% of type 2 diabetes, and 40% of cancer. Right, wow. And the beautiful thing about lifestyle medicine is that it has the power to prevent problems, but it also has the power to treat problems. For instance, if a patient comes to establish care with me and their blood sugars are very high, so high that they would typically or traditionally need insulin, well, we're able to brainstorm together to say, hey, what do you think about maybe trying this whole food plant-based diet? What if we really dig in and try to do more healthy eating? Some patients are interested in that and then some are not, but the ones that are, we'll do a 1 or 2 week trial of just eating these whole food plant-based products that I'm talking about, and their morning sugars will start off at 300 like they were before, but within a few days you start noticing as they're writing them down, 240, 220, 190, 130, 120, 120. I can't tell you how many times patients bring in their logs and I can see the numbers just decrease, which is a good thing for diabetes and high blood sugar, and it's all from the diet. So for me, that's a wonderful story. I also have patients who have high blood pressure and they are on multiple medications. And we say, hey, what is your plan? Would you like to get off of some of these medications? And oftentimes they're able to whenever they change their diet from maybe eating some of those processed foods that may be in a TV dinner or fast foods, and we're able to shift it to the whole food, plant-based diet. Another common example is with anxiety or depression. Obviously, medications may be needed, but if we're not bringing in the right foods into the body, how could we really expect their body to truly heal? We're also finding that the amount of inflammation that processed foods cause greatly impacts their mental health. So part of every treatment plan for me when I'm working with patients is going to have some component of healthy eating, and ideally working on the other domains of lifestyle medicine. What I also started to learn during my early part of my medical training is that there are some patients that have things happening in their life that are way out of our control and my control, and I'm not really that helpful. Sure, I can help someone with high blood pressure and diabetes, but you know what I'm not as helpful for is when someone's looking for new housing, or that they have got such a mold infestation of their house that that's why they're having these coughing spells and having to go to the emergency room for prednisone and everything else. And another example would be someone comes to me saying, my credit score is so bad right now that I'm not eligible to enter or to look for new apartments. They won't even look at my application. Or when they say, you know, I don't even have the $700 of savings necessary to put a down payment on for a new place. Or like the patient will tell me, I'm working every day, but my car is starting to have problems and it's going to cost me my job. You know, I can't just write a prescription for a used Honda Accord to help them get to their home, or get to their work. It'd be nice because I know that if they could keep their job, that's what's going to help keep them afloat during these really difficult times. Some patients live in rural areas and they don't have access to the food, the healthy foods that they need, or any food. And so they say, well, how can I go to the food pantry when there's no bus route that can get me there? Or when I go to the food pantry, they'll only give me enough for a few days and then I'm out of food, but I really need to go back every few days to get more food. Or maybe a patient and her mother comes in, and this patient, I remember vividly, has a history of autism, and the mom was just completely exhausted and just said, well, is there somewhere I could go just for a day or two that someone could look after my son so that I could just rest and recuperate so that I could come back and be the best mom I can be? And all of these examples I'm telling you are what I hear on a constant basis, and I just feel helpless. I just feel like, man, I feel like I'm not able to do much. So that started my journey of going out into the community, trying to understand which organizations are there, which ones can help patients. And my role in what I help with community health is how do we connect patients to these other organizations that are already doing this type of work. So we've talked earlier about how lifestyle medicine are these behaviors that you can do to improve your health. And what I also would like to point to your attention is to these social challenges I just discussed about the transportation, the access to healthy foods, the car repairs, or the access to credit. Those are sort of in the social domain. And we call these social determinants of health. And so if you would be so kind as to, next slide. So this is a busy slide, but what it does is outlines the different categories of social determinants. And if you were to Google social determinants of health, you're going to find a lot of literature and a lot of different theories about it. But what I will point to your attention is that there are things such as economic stability. That's work coming in, being able to have a job to go to. Then you have neighborhood and physical environment. That's like, is there access to a park nearby or to a greenway? You know, there are some people that don't have access to greenway, so they're at a disadvantage, for instance. Then you've got the education side, which is vocational training, GED completion, early childhood education. And then, you know, continuing to look through, you'll see other domains such as community and social contacts, which is basically, do you have a strong support system that could help you out in a difficult time? And then healthcare system, which is like how many doctors are there per 1,000 people that live in this area, or how many hospitals are in the area. And so these are social determinants of health. And I'll just caution you that while this work is so important to address, it takes a lot more collaboration, and the time frame is way different than working on healthy behaviors. For instance, if you're going to try to, for a community to say, look, we'd love to bring in more greenways. We'd like people to have more access to a park. That planning that requires is usually months, if not years. You've also got to work with budgets, probably decades even. Budgets, you've got to work on policy, you've got to talk to the key stakeholders, you've got to have community buy-in. And with all of those, there'll be episodes, there'll be times when things are going well, and there'll be times when they're at a complete halt. And for me, I worry about that being sustainable because that really slows momentum down. Another example would be the time needed to build a new hospital in the area. That would do wonderful things for bringing clinical care to the town, but that is also a multi-year process. And a lot of times those decisions are made behind closed doors with executives that have the influence to sign dotted lines to make things come in to be. So while I am focused and always looking to collaborate to build new social determinant or new organizations and new opportunities that address the social determinants of health, just know it is a challenging process. It's worthwhile, but as you continue thinking about ways to collaborate with the community, I would say that continue to think about the momentum, and is it something that everybody could be involved with? For instance, I feel like most everybody could be involved with healthy cooking and healthy eating versus not, it'd be typical to get everybody involved in the planning phase for building a new greenway in the area, for instance. All right, and would you change to the next slide, please? Thank you so much. So this is a slide from the Robert Wood Johnson Foundation, and it helps sort of us understand, well, out of all these things you've talked about, what are going to contribute the most or impact the health outcomes the most? And you may be surprised. So the clinical care, the idea of having a doctor, the idea of taking medication, that really only contributes about 20% of your overall health outcome. Now, the physical built environment, maybe having a bus line that goes nearby so they can catch the bus, overall, that may only impact about 10% of their overall health outcome. But when you start looking at the social and economic factors and the health behaviors, you're talking 30 to 40%. And so the social and economic factors, that would discuss like employment or raising the minimum wage, for instance, having fighters nearby or police officers nearby. And then the health behaviors is exactly what we talked about earlier with the lifestyle medicine, which is why it's so powerful, because it does influence health outcomes so much. I would say that, with all the new jobs coming into Cabarrus County, it's always a wonderful thing to hear and read. That in itself is going to do more for the health of the community sometimes, just by bringing in new jobs, because new jobs means more income. It means guaranteed health insurance for most employers. So for me, this is really important to think about as you start trying to understand what kind of work you'd like to do in the community. Next slide, please. Then this is the public health pyramid about the impact of some of the interventions. So just to help orient you, as you go down to the base of the pyramid, you have increasing population impact. And to the top of the pyramid is the amount of individual effort needed. So an example would be to spend quality time with someone one-on-one to educate them about how high blood pressure is going to take a lot of one-on-one time and energy and time. Now, and it's only going to affect that one person. It's not going to affect the whole community at large. But if you think about the socioeconomic factors, so if someone decides to build a new plant in Cabarrus County and open up all these new jobs, that's not going to require as much one-on-one time, and it's going to impact the community as a whole. The challenge with the socioeconomic factors is often it's hard. It really depends on the few individuals that can sign the dotted line to make something big like that happen, versus, which I would advocate for, lifestyle medicine education and helping people eat healthier is going to do a lot of the top. It's going to be the counseling and education. It's going to be the clinical intervention, which I've already talked about, how I'm using that with patients in clinic about how it reverses diabetes and hypertension. It's going to lead to long-lasting protective interventions, especially when we educate our children how to eat healthier. And then it's going to change the context for an individual's default decisions to be healthier if we can make it ready, plentiful to have healthy options on hand versus the convenient option of going to a local fast food store. So for me, one reason that I would always advocate for healthy eating and finding new interventions to educate those in our community about how to eat healthy is because it's going to hit on those top four, and that's going to be quite powerful for a community once it gets momentum. So next slide, please. Thank you. So this is a survey tool that I've administered to about 20 of my patients and their families. It's called the Aspire tool. And what it does is it categorizes patients' needs into different categories of red, like a stoplight, like that means like there's a serious problem. Yellow is like be cautious, something could go wrong and that could be a real issue. Or green is they're in a good place. The most common example would be transportation. They have access to a car, they're going to be green. If they're going to be yellow, if that their car is not working all the time or it's inconsistent, red would be they've lost their car. So you can see these are just a snapshot. What I see time and time again are patients need a lot of help with managing medical debts and debts in general. They need a lot of help in navigating credit score and how to improve their credit score. And that usually takes some one-on-one time to help them work through that. And we don't have a lot of resources in the community that can help with that. You'll also see here the nutritious diet and the physical activity, consistently some of the lowest scores or the most red, which is, again, like should definitely grab your attention. So, and I'll also point your attention to the community aspect, which is when I ask patients about, are you looking for healthier friend groups or a better support system? And absolutely, a lot of them are. So this is some data. I'm happy to share these slides. There's more data, there's more of this where it came from. So happy to continue to provide as much data as I possibly could. Next slide, please. Thank you. Cabarrus County, since we're speaking of surveys, they started surveying a lot of community members in Cabarrus County, and then they brought a lot of us together into a room to start brainstorming, well, what are the needs of Cabarrus County? And you may have seen these before. So housing has been a consistent need in Cabarrus County for many years. This needs assessment is done every 4 years, and so it's sort of a fresh perspective, but housing has consistently been a need. Mental and behavioral health has been a need, and then early childhood education and development. So if you were to ask me, well, what's something that All Saints could do, or at least consider doing, to start this process of engaging in the community even more than you're doing right now, and doing it specifically with healthy eating, I would say consider this. What if, with the new daycare, what if our role was to do our best to make sure that the food being prepared for the children align with this whole food plant-based and evidence-based lifestyle changes that are been shown to really prevent disease and reverse disease? What if we work together to make sure that's happening? And then what if we collaborated with Cabarrus Health Alliance, who is our public health department and public health authority, Meals on Wheels, and the University of Charlotte to build on an existing Walmart grant that basically funds refrigerators to be put in daycares for pre-prepared meals to be already placed in these refrigerators, so that when mom or dad comes to pick up the child at night from the daycare, that not only do they pick up the child, but they also pick up the food that is then basically put in the oven, and then they all eat dinner together without having to worry about the preparation side. So there's work already in the county that's headed this way, and I think it would be a wonderful opportunity to consider making this daycare here a satellite, in a sense, of this grant. And I would say that you will find lots of support about lifestyle medicine in the community. Dr. Bonnie Coyle over at Cabarrus Health Alliance, as well as myself, and the North Carolina Research Campus, we are all oriented to lifestyle medicine and these changes. It is a personal passion and belief for us, and I think that if we could all collaborate together, it would allow for new opportunities. I work closely with the families in Cooperative Christian Ministry in their transitional housing program. And when I do home visits with them, oftentimes there's multiple families there in one house, and they all struggle with diabetes or high blood pressure, and they want to eat healthier, but often what happens is that the food that's brought in from churches that have been kind enough to donate their time and food and energy, is that those foods are the same foods that are causing the diabetes and the high blood pressure to begin with. And I think one thing that would be really powerful is if All Saints were to help lead in the spiritual world, in the spiritual community, in the faith community of Cabarrus County, this notion of lifestyle medicine and how impactful it can be. And I could just imagine that a lot of the problems that those families are struggling with anxiety, with hypertension, diabetes, would likely go away if we were able to change their dieting. And so, in conclusion, I will share with you my program that I've created after hearing lots of things from patients of what they need. So if you would be so kind as to forward one slide. So I realized that when I was in the clinic, I wasn't getting the full picture. I felt like I was missing something. You know, they give us 15 to 20 minutes to spend quality time, and it's tough. And so whenever I started feeling like I was missing something and there was more to be done or more to learn, I said to my patients, what do you think about me doing a home visit? You know, home visits, doctors do home visits. And so, but our home visit isn't really just looking at the medications they're on. It's about understanding what are their health goals and what are their challenges. And so the program has evolved into what I call lifestyle medicine at home, and it's the first of its kind. And it's been very fulfilling for me. So it's got 3 core pillars to it. One is that it's always oriented to the family. It's family medicine doctor, it's sort of in my DNA. It's focused on the lifestyle because I know the power of lifestyle changes on overall health, and it happens in the home, which is where health happens. You know, people come to see me in the clinic, and that's not where health really happens. Health, preventative health especially, happens in the home where you decide to drink something or eat certain things or whatever it is else you do. So I'm very proud of this program, and it's made up of a few things in this last couple of minutes I'll share. So one is this high quality in-home education. So if a patient is smoking and they want to cut down, what we'll do during the home visit is say, well, take me through your routine. What are the triggers that that happen to you? And so one example is that, patient said, well, every time I kind of come out at the patio, I sit right here, I've got my ashtray here, and this is kind of what I do. And even if I walk by the patio, I start thinking about cigarettes. So we rearrange the patio furniture. We change things in their home environment. Another example is with trouble sleeping. Well, we do a sleeping quarter assessment where we say, hey, what do you think? Is it possible that maybe this light that's coming in, is that an issue? Or maybe this big clock on the wall that you hear ticking constantly is maybe what's keeping you up. And that's just one example. So another is that we use this time to do more education about what they're like, well, I'd like to do more walking. Well, maybe that's what our home visit is we all get out together and do a walk. And so it's been very powerful, and I think that having the doctor come in to do that shows them that it's important. The other side is this community referrals. So once we find patients that want to explore how to eat healthier or how to get more exercise, we'll refer them to, say, YMCA. Or if they are having issues with their house and they're having a mold infestation, we'll put a referral into Habitat for Humanity. And so there's a platform online called the Community Resource Hub that allows us to take a patient and put a referral in so they can be connected to community resources. And I'd love one day to have All Saints as part of that so that as we encounter patients that would do great with your program, we could just put a referral into the Community Resource Hub. The third component of lifestyle medicine at home is what we call lifestyle equipment. And these are things that patients need and they can't afford, but they need it in order to be healthier. A good example is a new pair of tennis shoes so they can do the walking. Or they've got COPD or asthma and we do air quality testing and their air quality is not good, but they can't afford an air purifier. So we have funds set aside to purchase that for them. And some patients don't need the help, but some do, and a lot of them do. Another example of lifestyle equipment would be cooking utensils. So they want to cook broccoli, but they don't even have a pan. Or maybe their knife is all bent and they actually need a new knife. So those are sorts of things that we try to help patients out with once we identify the need. The fourth aspect and final aspect is probably the most important, and it's what we call a lifestyle prescription. Would you please be so kind as... So a lifestyle prescription is a goal that the patient creates with you to start their journey to be healthier. Most common prescriptions are something like 2 handfuls of a fruit once daily, or walk 1 lap around your neighborhood 3 times weekly. Or it could be pray when stressed for 15 minutes, or read Bible. I mean, it could really be whatever the patient feels is going to help them on their journey. And you can see there are different domains. And those domains on the top of healthy eating, stress, substance, they all align back with the lifestyle medicine domains. And so this work actually would not be made possible without the help from Dr. Robinson. And when this work was in its infancy stage, we came up, and Dr. Robinson came up with this idea of a POW, a prescription for an abundant life. And so this was a prescription of, maybe trying back church one time, or going to the senior center to meet other people, whatever it is for a prescription. And so, in conclusion, as a token of thank you, I have something for Dr. Robinson. You may notice that the prescription, it says 100 on top, right? Well, I knew that when we were ordering these, that I knew who the number one would go to. Thank you all.
Thank you, Dr. Nance. We're going to open up to questions. Does anyone have a question or comment for Andrew? Oops, sorry. And I'm going to hold the mic just to make sure it's...
Dr. Nance, thank you. I'm really intrigued and fascinated by that lifestyle prescription idea, and
Yes,
I'm
ma'am.
curious, how widespread is its use? How many doctors are doing that?
This is the first time that Atrium Health has ever heard about lifestyle prescriptions. So we are the leaders in this work. We being this room right here and me. We are the beginning of a wave that I hope gets larger and larger. I also teach the residents how to write lifestyle prescriptions. I also teach nurses at the Cabarrus College of Health Sciences how to write lifestyle prescriptions. And together, when we do these home visits, they're usually with me, and they continue following up with the patient to create new lifestyle prescriptions. And a lot of times, these are things we were already doing in clinic, but we would just say it. Hey, yeah, you're going to eat healthier, right? But what we learn is just being people, we need specific goals. And that's what a lifestyle prescription is. Great question. Thank you for that.
Anyone else? Do we have any comments from the
I see
Zoom?
someone over here.
Okay. I'm coming to you, Kathy. This is for our Zoom.
Okay. Thank you so much. How do caregivers go into a home to help with a lifestyle change without saying, forget your ways, our ways are so much better, why don't you do it my way or our way?
It's a beautiful question. I think there are three aspects. The first is that I've learned it's easiest to work with patients who are motivated. Patients that are not motivated to change it's frustrating for everybody. So if you find those patients that are tearful and they are looking for any help they can get, they tend to do better with any type of in-home visits or any lifestyle medicine prescriptions. The other thing is something called motivational interviewing, which is an approach, it's a patient-centric approach for how to understand what are the motivators for a patient to change. And it's less of, this is the right way to do it, and you need to eat like this, and it's more of like, what is your understanding of what is healthy and what that would do for you? And you'll hear them say, well, I think that would give me more time with my grandchild. Or that would help me work more, and that's important to me. And then you use those reasons to start saying, well, what do you think we could do to help you get a little healthier so that you can continue to do that? And motivational interviewing is a process that takes some time. And so I've always envisioned that anybody to be part of this work, to do home visits with me, would also have some basic training in motivational interviewing so that you had the skills and the confidence you need to navigate these challenging conversations. And then third, I would say, is trust. And perhaps trust is the most important. I've realized that doing home visits and building from the trust of a doctor and patient, the level of trust just skyrockets. I mean, patients already trust me just as soon as I walk in the door, but when you are a guest in their home and you are humble, and it just changes the whole amount of trust. And I've realized that that trust that we create can then be shared, and it can be handed off to other people that come with me to that home visit. Maybe the nurse or the community health worker or a member of this congregation, especially if there were a patient that you find that, or a person that used to come to church here and wants to come back but needs another connection point. Well, you know, maybe someone from your congregation could come with me to the home visit. So that is, is a really great question, and it would take some more time to make sure that you had the skills and tools you need. But again, highly motivated patients. Think about motivational interviewing, which would give you the skills and confidence to navigate these conversations, and then think about trust, because trust is crucial.
You addressed the very interesting concept of bringing the refrigerator and the meals to the children, say, in nursery school. And I know a program in Massachusetts that is doing it, and my niece is one of the nutritionists who runs it.
Wow.
But getting to the school children who are now getting provided with free school lunch, I would like your opinion on how wholesome are those free school lunches?
Yes, thank you so much. We have definitely found that that having free access to foods is going to be very important for our children. We're actually got lots of work underway about addressing the quality of the food, but we hit this roadblock of, well, okay, well, how are we going to bring in healthier foods? You hit, you know, delays and shortages from food and travel. There's a lot of logistics, and a lot of the people that work in the cafeteria may not even be comfortable with preparing some of these healthy foods. There's a lot that goes into that, but I think that the more that we can gravitate around healthy eating, the more power and voice we'll have, so that we can all go together to Cabarrus Health Alliance and Department of Human Services and the Cabarrus County Schools and advocate for this work. So, and I think you're having a family member who's already in this world is a perfect example of how powerful we can be, because we're all connected to experts, and we can bring them all in, even if they don't live here. So that would be wonderful to share that experience. So thank you for that question.
Sorry. Thank you, Andrew, for my gift.
You're
I'm
welcome.
overwhelmed. Two questions. One, is anyone doing how to eat healthy classes now, since the pandemic stopped what was going on here? And secondly, can you share the really innovative thing you've done with the College of Health Sciences on your home visits?
Absolutely. Thank you for that question. You're very welcome for your gift. Right now, obviously with COVID, healthy classes have, and healthy eating classes have been sort of suspended indefinitely. There is a kitchen over at Cabarrus Health Alliance, but for us, knowing that we have the Cabarrus Health Alliance, which is our public health department, they could provide guidance on ensuring that our cooking classes here were up to speed and that they weren't issues with hygiene, including COVID precautions. So that is something that definitely could be started back up again whenever the layout was right. In terms of the collaboration, so you may not know this, but right across the street is Cabarrus Family Medicine, the residency, and they graduate, thanks to the help of Dr. Robinson, they graduate 8 residents a year in family medicine. And then if you were to turn a little bit this way, there's the Cabarrus College of Health Sciences, and they graduate probably 200 to 300 students that are either nurses or medical assistants or radiology technicians. And what we've been able to do with this Lifestyle Medicine at Home program is called interprofessionalism, which is kind of a new world that we're finding out that patients need. And otherwise, these two places were sort of in a silo on their own. But now we're basically sharing families and sharing patients and sharing home visits, so that in the future that those students and residents have the confidence to do home visits, but also the confidence to write lifestyle prescriptions. And I will say that I'm very proud that there's nowhere else in the nation that's doing anything remotely similar. Working with agencies that are in charge of developing new ways of preventative care and primary care, nothing like this, nothing at the level of interprofessionalism, nothing at the level of home visits, and nothing at the level of lifestyle medicine. So I plan to make this my life's work.
Yes, I have a concern and a question, and that is the way our healthcare system realistically is structured is actions follow money. And you have a passion and you're making sacrifices to make these home visits, but for this to really happen very widely, the system has to reimburse the providers to do that, and they have to have support from whatever big medicine they're working for, whether it's Novant or Atrium or something else, Blue Cross Blue Shield. So my question is this just a labor of love for you and the other people who do it, or is the system putting some financial commitment to it?
Yeah, thank you so much for that. So my time has actually been, with the help of Dr. Robinson, has been earmarked through a grant from the Cannon Foundation so that we could develop this type of work. So that's a good start. Also, in terms of the billing side, not to get into too of the details, but the doctor, myself, and others can actually bill in a place of service in the home, just like it's in the clinic. And you can technically, not just about money, but you can technically bring more money in doing home visits than you can in the clinic. So there's a pathway for reimbursement. Also, there's a shift for trying to understand what are the major diagnoses for a patient. For instance, type 2 diabetes with neuropathy, which is the nerves aren't working in the feet. That, for the insurance companies, they want to know how complex the condition is. And so what we have found is that actually doing the home visit, it gives me the time and the space to actually accurately diagnose, which is going to pull in more money for the system when the insurance company says, well, how complex is the patient's health? So I have been sneaking my way onto meetings and trying to advocate for this work. And I'm really proud to say that they have asked that Lifestyle Medicine at Home, and by they I mean Atrium Health, to basically explore this whole idea of home visits. And insurance companies like Medicare, some of the Advantage plans, they will do home visits on patients, and they'll send me the report. And we've always thought at Atrium Health, well, why are they the ones doing the home visit when we could do it and we could do a better job? So you find that there are early adopters, and then you find there are late adopters. And so I'm making sure that I align and communicate with those early adopters that are willing to take a risk, and also ensuring that all the feedback that patients give me are packaged in a way that it aligns with what the overall goal and mission of Atrium Health is. Wonderful question.
We have about 5 minutes left. Alice, I'll be right with you.
Am I holding it or you? Okay. So I just wanted to say, as a nurse, I am thrilled to hear that you're talking to different disciplines within the healthcare and involving them. And even though I spent my career at Novant Health, I'm really impressed. So I say big kudos to you. That's great.
I appreciate it. That means a lot. My mom's a nurse, and I think that's where my initial idea of interprofessionalism really blossomed from, and I just saw the power of having a team work with patients. And so I appreciate you saying that.
Dr. Nance, thank you for coming today. To what extent, because you talked about socioeconomic factors, and there seems to be a lot of overlap and adjacencies with transportation and housing and food, for example. Can you say more about income levels and how those affect all those different needs?
Wow. Wonderful question. Thank you for that. I think probably the most consistent concerns I hear from patients is about income, and that they're having to work multiple jobs, often 2 or more. And then they don't have anywhere to, there's no childcare. So then they can't do one job because there's nowhere to drop the child off. And if they do drop the child off, the costs are exuberant, so they're not able to afford it. And then they're so swamped with everything going on that they end up deferring to like the convenience of fast food. And then they realize that a lot of the healthy vegetables and fruits out there are a little pricey at times, and they may not have the tools and skills yet to buy those affordable items and to navigate creating healthy meals. So I find that those patients that are able to get to that $15 an hour, a little bit higher income, have incredible strides of their overall health. And even without starting medicine, when they come see me, 10 weeks later and they've got a job and they're making more money. Their stress levels are way lower consistently. And a lot of times the anxiety and depression that we would typically just medicate are usually gone once their income goes up. So it certainly speaks to the universal need for guaranteed basic income, especially with the minimum wage that's higher than standard.
So if we talk about, obviously $15 an hour is double what the current minimum wage is. In some cases, Atrium, I believe, now pays, their starting salary is $15 an hour. So it is with Federal Express and Amazon locally. But what does that get you? Some of those, well, it gets you some, if you have a full-time job, it gets you a little over $30,000 a year. But it's very difficult to get those jobs that are 40 hours. So with regard to part-time work and full-time work and wages, can you elaborate a little bit more about where you find your patients?
Yeah, absolutely. If a patient comes to me and they feel like money is really tight, the first thing I do is have them apply for food stamps and to make sure that they've been receiving all the government benefits that are available to them. Your point is well taken. I think it's nuanced because every patient is in a different situation. A lot of times they may have debts that are owed, and sometimes if they do make more income, they still may not pay those debts off. And working with Cooperative Christian Ministry and Prosperity Unlimited, they've created some programming to do more education about what to do with new money that you have. And they actually give an incentive if you complete the course, which takes about 6 weeks, they give you $500 or $1,000, if I'm not mistaken, to then invest in whatever you saw fit from the things you learn. So you're right. It may not be as simple as just increasing the bottom line or the minimum wage per hour, but it's probably part of it. And I think that unless you can do really a lot of one-on-one education with patients about, hey, this is why your debt score or the credit score is like this. This is how we get your debts repaid. Hey, and by the way, like one example I had for a patient, his utility bill went up to about $600, and you would think this is pretty, like, you should know this, like to leave the window open in the winter and have the heat going. But you've got to understand, like, there are some patients out there and people out there that they just don't quite make the connection. And so you have to spend one-on-one time with them, educating them. And again, as we saw in that pyramid, that takes a lot of time and energy. So one quick fix is the bottom, that's socioeconomic, where you just give them a little bit more money. But you're right, that may not even guarantee success. So it has to be kind of a mixed. A little bit more money perhaps, and then some real digging into next steps to help them rehabilitate their life. Yeah, beautiful question.
I think this will be our last question with live stream.
Dr. Nance, you made at least one reference to a community health worker.
Yes.
Could you talk about the increasing role of community health workers in ensuring that the referral loop is closed? And then also the effort here in North Carolina you mentioned a referral tool with which I'm not familiar that might be specific to Atrium, but could you talk a little bit about NC Cares 360 as well?
Absolutely. Great question. Thank you so much for that. So before community health workers, what would happen is someone comes to me and I know that they may qualify for food stamps. So what I would do is I'd print off an application, I'd hand it to them, and I'd say, see you in 3 months. But a lot of times they don't have the skills to even begin completing that, and they don't turn in the application. Another example is like, well, here's a printout of all the food pantries. Here you go. But then they're just so overwhelmed they can't get there. So what a community health worker does is sort of walk with that patient on their journey step by step to make sure that they do go get the food, that they do turn in the application. And if they have issues with maybe reading or writing, that they're able to help them do that. And so it's a trusted member of the community. Usually this community health worker has no health background. There's someone that is just very passionate to help people. And there's been a large CDC grant administered to Cabarrus Health Alliance to upstart a community health worker program in Cabarrus County. And right now we have 6 community health workers. And I host a monthly focus group with them to hear more about the challenges that they're seeing with their patients that they're helping. And I'd be more than happy to involve some of you in that work, because you would hear firsthand exactly what the needs are in the community. And then this community resource hub is it's a breakthrough technology. It's a milestone in terms of community health outreach. Now, in addition to having a community health worker, I can put the patient's information into the internet system and send it as an email, a HIPAA-compliant encrypted email, to an organization such as Cooperative Christian Ministry or DHS, so that the DHS or Cooperative Christian Ministry is even aware that this patient exists, and then they make sure to follow up on the application with the patient. So this handoff is crucial, and it is an incredible breakthrough, and that is where I'd love to see All Saints on the receiving community organization side once you find a program that you'd like to offer to the community. Thank you very much for that.
I think our time is up, and I thank you all for your great questions, and thank you, Dr. Nance.
Absolutely.
Andrew, we're just so appreciative.
Thank you for the opportunity.